Welcome to Mental Health First Aid. My name is Denise Ellsbury, and today I'm very excited to have April Johnson with us. She is the manager of the Edward Hospital Sleep Center, and I've been really wanting to have her on our show to talk more about just understanding sleep in general, and maybe later on we'll get into a discussion about how sleep impacts our mood and the connection between mood and sleep. So welcome, April, and thank you for being here.
Thank you for inviting me.
All right. So maybe we can just start out by talking about what is the sleep center and what happens there?
The Edward Hospital Sleep Center is a 10-bed diagnostic and therapeutic testing facility. We primarily see patients age 6 months and older, so we do see pediatric patients as well.
Wow.
And we are accredited to do that under the American Academy of Sleep Medicine, which is a governing body based out of Darien, Illinois, that oversees the guidelines and protocols for sleep centers across the country.
Okay. So even as young as 6 months, patients can be referred to the sleep center.
That is correct.
Okay. So what happens when somebody gets referred there?
Well, they're contacted by a member of our staff to schedule their appointment. We ask some comprehensive questions to ensure that first the study is appropriate for them, because even if a family practitioner does order the study, it's not always appropriate for them to come to us first.
Mm-hmm.
They may need to see a sleep specialist in consultation prior to performing a sleep study to ensure that the most appropriate test is ordered for the patient. So after assessing their sleep patterns and asking them questions about their care to ensure that we are scheduling them appropriately as well for our staff, if we have a patient that has some developmental issues, we need to be aware of that prior to their coming in so that we are ensuring that we're meeting their needs while they're there. Mm-hmm. If a patient has other comorbidities or there's some assistive devices that are necessary for them to use, so if they're using a wheelchair or a scooter, we want to know all of those things. If they need to use a lift to get in and out of bed, we have to make sure that we're properly prepared for their visit that evening. So we're asking all of those questions prior to the patient is coming in.
Mm-hmm.
And at that point, we then confirm an appointment, send them an information packet with directions to our facility and pre-test instructions. There are no restrictions for the test itself for the patient. It's just a matter of them being aware of what we're doing that evening prior to their arrival. They would need to pack an overnight bag
Mm-hmm.
as if they're staying away or at a hotel or something like that.
Okay.
And that's really important because a lot of our patients show up without reading their information packet
Uh-huh.
and are caught off guard when they need pajamas. It's more, our rooms are set up to be more like hotel rooms as opposed to hospital rooms because we want the patients to feel comfortable sleeping there. It's an unusual test,
Uh-huh.
and most are not familiar with the test itself in that they think that we're sitting in the room watching them sleep all night, and we're not. We're actually in a separate control room monitoring them for their safety. There's a camera in the ceiling. And there's a private bathroom with a shower, but again, reading that information packet helps them know to bring their own toiletries and things like that.
Mm-hmm.
We do supply some things, but it's just important for them to be comfortable, and if they have to be prepared to go to work or another appointment the next morning,
Sure.
we want to make sure that they're aware of those options.
Mm-hmm.
Once they're confirmed for their appointment, they're coming in in the evening, and we usually schedule them to arrive approximately an hour and a half to 2 hours prior to their normal bedtime. So if we're going to bed at 10 o'clock in the evening, we have them come in about 8, and that allows the tech.
I was going to say, kind of like you want them to kind of do as much as normal of their kind of bedtime routine.
Right. We don't want them to come in too early or too late because it'll throw off their sleep schedule a bit.
Mm-hmm.
If they're attempting to go to sleep a little earlier than they normally would, they wouldn't be able to sleep very well for us, and we're not really getting as accurate a reading on the data as we can.
Mm-hmm.
That gives, having them come in a little bit earlier allows the technician to explain the procedure and set them up with the leads and sensors that we'll be using for the test that evening.
Mm-hmm.
And there's about 26 leads and sensors that we're
Wow.
placing on the patient's body,
Mm-hmm.
so that we can monitor their sleep activity, their respiratory effort during sleep, any snoring activity is monitored, as well as their heart rate, muscle tone, and oxygen levels.
Okay. Are you mostly paying attention to respirations, or is that like the main reason sometimes people get referred?
It is looking at patients who possibly have obstructive sleep apnea or some type of a respiratory disorder that's related to their sleep problems is a primary reason for a lot of the patients that we see in the lab. But we also see some patients who are coming in with hypersomnia, which is an excessive daytime sleepiness disorder. So they're having difficulties maintaining wakefulness, and the doctors aren't sure why.
Okay.
So they're coming in overnight so that we can monitor their sleep in detail to ensure that there isn't a sleep disorder breathing issue, or there
Gotcha.
isn't a pain issue or involuntary muscle activity that might be
Okay.
causing arousals in their sleep, which would then lead to some of the daytime sleepiness that they might be experiencing.
Mhm.
So once we have their sleep monitored in a control environment overnight, then the doctors can better deduce what may or may not be going on by having the patient also do a daytime study the very next day. So
Oh,
those
okay.
patients are usually with us for about 18 hours total for their visit. And we do what I kind of, I joke, it's not really a funny joke, but I think it's a little torturous,
Mhm.
but that's my own little word, because we are essentially waking them up in the morning and instructing them to change out of their pajamas into street clothes, and then every 2 hours we monitor them for naps that can last anywhere from 15 to 35 minutes. And often as the patient's about to fall asleep, we wake them up.
Okay. So people that have that sleepiness or during the day, what was the term you used?
Hypersomnia.
Okay. So they're like dozing off for sustained periods of time during the day, and what you're doing is, when you're monitoring that or assessing that, is kind of not letting them fall asleep to
The
see.
idea is to see if they do fall asleep, and if
Okay.
they do fall asleep, how quickly are they going to sleep, and whether or not they're going into a deep stage of sleep.
Oh, okay.
Because if we're sleeping normally and we don't have a daytime sleepiness disorder, it should take us about 15 to 30 minutes to fall asleep normally.
Okay.
But if you are falling asleep pretty much as soon as your head hits the pillow and there aren't any other issues going on, it is very likely that you have some form of a daytime sleepiness disorder, and that includes narcolepsy.
Okay. So when you say like it takes 15 minutes or so to fall asleep, is that like I'm in bed for 15 minutes before I fall asleep, or what does that mean? Like,
It really just means that you're not someone that is laying down and you're pretty
Boom,
much
you're
knocked
out.
out as soon as your head hits the pillow.
uh-huh.
It just means that it just takes you some time to relax, and your body's kind of adjusting to, kind of winding down for the day. So it's not that you're laying in bed watching TV or reading a book or anything, that you're actively attempting to fall asleep. And that process should take about 15 minutes minimum to get you to that point. And anything less than that can indicate some form of a sleep disorder because you were likely sleep deprived in some way.
Okay. So there is a lot to really understand about the whole pattern of sleep and
Yes.
how it can be affected during the day as well as the evening. So when we come back, I'd like to talk a little bit more about how those patterns of sleep can really impact our mood. So we'll be back, and we'll be talking with April more about the connection between sleep and our moods.
Tú no eres un superhéroe. Visita al doctor regularmente aun cuando te sientes bien. Así podrás seguir cuidando a los que sí te ven como un superhéroe. Para más información, visita ahrq.gov.
Whatever we deny or embrace, for worse or for better, we belong together.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Welcome welcome back to Mental Health First Aid. We've been talking with April Johnson, who works at the Edward Hospital Sleep Center, and she was telling us kind of about the process of when people are referred for a sleep study, what's all involved in that. But I'd like to talk a little bit more about the connection between sleep and our moods. So what are some of the things that are being talked about or discovered in terms of the impact of sleep and how it can impact our mental health, or just kind of how we feel during the day?
Well, sleep is an important part of our lives, and in this day and age, we don't necessarily always treat it that way. We're a very fast-paced society, and most people don't get the required number of hours of sleep. So a primary concern, not just with a person suffering from a sleep disorder, but people in general, is that we are often running around kind of sleep deprived. Simply because we're not aware of how many hours of sleep that we need, that our body needs, and that we're not adjusting our lives around getting enough sleep.
People kind of put that off to the side and like that's way down on the priority list
Yes.
of what I need to get done today.
That is absolutely correct.
Can I just ask, since you were mentioning about appropriate hours of sleep, what are recommended hours of sleep?
For infants and toddlers, and children, it kind of varies a bit. Obviously, for babies, their sleep patterns are cyclical until they get a little bit older and are sleeping more consistently. So napping usually continues up through the kindergarten age,
Okay.
for 4 or 5 years old. And most children and adolescents require anywhere from 9 to 10 hours of sleep. They're not always getting that because of the school hours, and that's actually a different topic or conversation. But adults are actually recommended to get anywhere between 7 to 9 hours of sleep, and college-age adults are actually still considered to be adolescents in terms of their sleep patterns. They too should also be getting 9 to 10 hours of sleep, and that usually continues. It's estimated to be at through 22 for women and about 25 for men to stay on that pattern. But
Okay.
life does happen, and we don't always get there. But
Right.
adults usually should get anywhere between 7 to 9 hours of sleep. And in order for you to figure out what your number should be, it's usually recommended that you keep a journal for about 2 weeks, documenting what time you went to bed, whether or not there were any awakenings, whether you had any naps that day, and how long those naps were in duration, and what time you got up in the morning. And when you wake up in the morning, you want to write down how you felt. Did you
Okay.
feel good? Did you feel bad? Were there any morning headaches? Was it a restless night's sleep? At the conclusion of the 2 hours, not changing anything about your sleep patterns, you want to go back and look at the days that you felt like you got a good night's sleep. And that's usually the number that your body is actually needing.
Okay.
I need 7 hours. If I get 8, I don't feel that great. It's
So
like I'm
too much
oversleeping.
okay.
Oversleeping can actually have the same effect of not sleeping enough in
Okay.
some people. Not everyone, but in some.
So that's one of the things that you kind of recommend to people, is to kind of do that sleep journal to get that sense of what's working best for them.
Right, because it's different for everybody.
Sure. And then you can begin to make that connection between how well you're sleeping, or how much hours of sleep
Right.
you need, and how you were feeling during the day.
Right, because sleep deprivation actually results in sleep debt
Okay.
that you never actually get to pay back to your body. If your body needs 8 hours of sleep and you're only getting 6, each night you're losing 2 hours of sleep. So at the end of the week, you've amassed, like say the work week, you've amassed a debt of 10 hours of sleep.
And you can't make it up.
No, because you would have to literally sleep those 10 hours on Saturday plus the 8 that your body needs. And that is highly unlikely that you would ever be able to do that. But it isn't really something that you could make up in one day.
So what's the long-term impact then of that sort of sleep debt?
Behavioral changes, you're irritated, there's some mood issues, you're easily angered. I think we see a lot of our judgment is off, our perception of things are off. We're more accident prone when we're not getting enough sleep.
Okay.
The Illinois Highway and Safety, I actually forget the actual initials, so I apologize. They actually say that a lot of the drowsy driving, I don't know if you've seen on the expressway.
I saw one on my way here, actually, was like fatigued driving is what, dangerous, right?
It is. It's actually comparable to driving under the influence of alcohol. They estimate that someone who's gone more than 20 hours without sleep, and actually I think that that number is a little high. I would say that if you've gone, you know, longer than 12 hours without sleep, that your body is actually kind of running into some issues with their judgment and their perception,
Okay.
and shouldn't be driving.
So interesting that you bring up those issues of, like you say, judgment, perception, and I was thinking like just how that impacts communication between people. In that, you know, if you're if it's impacting your perception, then maybe you're more sensitive about how people are talking with you, not reading those communication cues accurately.
Yes. I think that it's just, we're seeing it in a lot of our patients that are coming in, you know, they've kind of been operating this way for a while and not really realizing that they may be causing some of their issues. A lot of insomnia patients have what is known as behavioral insomnia, because it isn't that, it may be that if they change some habits in their lives, that they may be able to correct some things, or at least the doctor may be able to pinpoint what their actual sleep disorder is if they can clean up their sleep habits a bit. So if they're keeping a consistent sleep schedule, if maybe they're turning off the televisions and the computers and the iPads and everything at least an hour before going to bed, then maybe they can focus a bit more and their brain will start to associate other activities like making your lunch for the next day, getting your clothes together. All of those activities are associating with winding down for the end of the day and getting ready for the next day. And the brain will start to associate those activities with going to sleep and
So
not being so anxious.
Gotcha. So some of the things that people can do to help themselves are establishing sort of that pattern every night of doing the same thing and preparing for getting ready for bed.
Right. When we were kids, our parents had us on a routine. Brushing our teeth, reading a book at night, getting our pajamas on, and lights out. And when we got older, we stopped those routines. You know, life kind of happened a bit, and we probably slept better when we were kids, when our parents had us on those routines. My mom, she would do all of those things, but then she would start her day after we all went to sleep. She would do other things instead of joining us in that routine. She would kind of couldn't wait to put us to bed and get going, and I think that's what a lot of parents do.
Yeah, you have your list of things that you have, your to-do list after the kids are in bed, kind
Right.
of thing. So what are things that parents can do to help their kids? And maybe let's talk about like teenagers. How can you help your teen sleep better?
Well,
Good luck with that, huh?
well, it's not that. A lot of teenagers actually have a natural inclination to go to sleep later and wake up later in the day. And that doesn't work for school, obviously.
So I'm gonna ask if we can just put that on hold for a minute, and when we come back from break, we'll kind of pick up on that in terms of understanding a little bit more about, again, what teens need in terms of their sleep and how parents can help with that. So join us when we come back, and we'll hear about how we can help our teens sleep better.
No, what'd she say?
She said whatever.
No, she says that all the time.
What's that?
Hello? I'm on the phone.
Mom, I'm on the phone!
Hello? I'm on the phone.
Who's this? It's me. I'm on the phone. Mom.
Oh, you're on the phone.
All right.
Sorry.
Sorry. Anyway.
Who are you talking to? Kelly?
Mom.
All right.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
It can be a little awkward when your friend tells you he's been diagnosed with a mental illness. But what's even more awkward is, if you're not there for him, he's less likely to recover.
I'm here to help, man, whatever it takes.
Welcome back to Mental Health First Aid. We've been talking with April Johnson from the Edward Hospital Sleep Center. And right before we went to break, I'd asked her about, how can we help teens sleep better? So what could parents do to help their teenagers get a good night's sleep and kind of develop good sleep habits?
Well, I certainly think what's applicable to adults is the same for teenagers and adolescents. Consistency, making sure that you're maintaining as consistent and realistic a sleep schedule as you possibly can. And that includes the weekends or days that they don't have to go to school, because you want to make sure that your brain is not going up or down when it comes to knowing when it's supposed to wind down for the day. With all of the activities and electronics that we have at our fingertips, it's kind of thrown the body off a little bit. Our bodies are a bit more primitive, and it used to be the sun goes up, we wake up. Sun goes down, it's time to go to bed. And with our televisions and our laptops and everything that we have in our bedrooms now, that light is representing daylight to our brain.
So even that little smartphone that is sitting at your bedside is going to disrupt that. The light from that is going to disrupt your sleep.
Yeah, I mean, if your child has a phone, it shouldn't be in their room at night. I watched my niece once while she was sleeping, and she had her phone on, and she was asleep, but she would wake up to text. She kept it under her pillow, and she'd just grab it, text some more, and go back to sleep. And it's funny to watch in the moment, but in real life, it was not a good idea for her. She was still in school. She needed to get proper rest. So keeping the phones and the televisions and the laptops out of all of our bedrooms is what is recommended for all of us.
So that smartphone isn't really a great alarm clock.
If you keep it out of your eye line, it should be fine.
Okay.
But it's, even if you just wear an eye shade at night, or positioning it in a way that the light is not disturbing you in any way, it should be fine. But because even an alarm clock position in your eye line is disruptive. So it's all about positioning, and it's all about knowing what your limits are.
So you're trying to have it as
technology-free zone,
and as dark as possible without any sort of light interrupting.
Right.
Okay.
Because it just takes a little, and your room should actually be a technology-free zone. They say you want it to be cool, dark, and comfortable.
Okay.
Is what your room should be for sleeping.
So a little bit on the cool side.
Just a little.
Okay. And why is that?
Our body temperature lowers when we're sleeping, and any elevations in heat and warmth or heat in the room can actually cause arousal activities. If you leave the heat on and if it goes off, especially if you're someone who's sensitive to sound while you're sleeping, it's going to wake you up. Even if you're not aware, it may wake your brain up enough that it's disruptive to your sleep activity, which could lead to daytime sleepiness and those morning headaches and not feeling well rested or at our best.
And how about pets in the room with you?
As long as you're not allergic, it should be fine.
All right.
But, because, they're going to scratch at the door anyway if they have to get up to go out and you don't have a little pet door.
Right.
So I think I've never heard a doctor say it's not okay to have the pets. Pets are a part of our lives for most of us. So.
Right. So just that importance of that regular routine, taking the time to prepare for bed, and cool and dark is what you're looking for in your bedroom.
Those are some simple things that we can all do and incorporate in our lives to get a better night's sleep.
And
some may think that it's not realistic given what our lives can be like sometimes, but it can be if you put in the work.
And like you say, those are things we can do. So those are things that we do have some control over often, that can really make a big improvement on the quality of our sleep.
Exactly.
So has there been any new research that's coming out about sleep in general, or?
Most of the research has resulted in some of the newer equipment that we have to treat sleep disordered breathing, like sleep apnea. I'm sure that there is some research out there on daytime sleepiness and things like that, because obviously the medications have to be adjusted and finding ways to keep people awake and being able to maintain their wakefulness if they have a daytime sleepiness disorder. But a lot of the research that we are directly involved with or are updated on usually affects the machines themselves that treat the sleep disorder breathing. For patients who get diagnosed with sleep apnea or some form of sleep disorder breathing, we use a positive airway pressure machine to temporarily splint open the airway during sleep while the patient is wearing a mask or an interface over their nose or their nose and mouth, depending upon what their needs are. And in some cases, some patients have a central sleep apnea disorder, which means that not only is there no air passing through the upper airway, we're seeing that their chest and abdomen are no longer moving, which means that there's a brain issue, there's a neurological condition there that's not getting the message to the rest of the body that we need to keep everything moving to pass air back and forth. And in those cases, we use a different type of machine. It's called an auto servoventilation machine. And that helps patients regulate their breathing.
That sounds pretty scary if the...
Well, it doesn't, it's, it's not something that, they're obviously, the brain will kick in when there's a rise in carbon dioxide in the body because there is no gas exchange. The brain will then kind of kick in and get everything going again, but it can last for a bit. When we see it on the screen, it can last a little bit. It does look, unusual if you're not familiar with it, but the brain compensates in some way, but it shouldn't be that it has to, is the problem. That's where the machine kind of takes over.
So is there, I thought you mentioned medication earlier. Are people sometimes prescribed medication to help with sleep disorders?
For insomnia, for narcolepsy or hypersomnia, there's usually medication prescribed in those cases. And that's, the insomnia medication is designed to help regulate their overnight sleep. Medications taken for excessive daytime sleepiness disorders or narcolepsy are prescribed to maintain wakefulness so that they are able to be functioning and so they can drive, because that's really important. Patients who have narcolepsy actually need their physician's permission in most cases to keep their licenses, and they can be driving safely on the road.
Wow, all right. So what kind of signs or indicators should somebody be looking for or maybe talking with their doctor about if they're that might indicate that there may be a sleep issue?
There are a few things. There are things that the patient would notice themselves, and there are things that kind of make them on high risk for having a sleep disorder without necessarily the patient noticing. Some things that they can notice for themselves is if they're waking up multiple times throughout the night for an unknown reason. And sometimes patients don't realize that if they're going to the bathroom during the night, that's actually a sign that something might be physically waking you up. You might not have sleep disorder breathing, but there may be muscle activity occurring. There may be some pain issues that you're dealing with. And those types of things are occurring, and they're arousing your brain activity enough to the point where you're physically awake.
Okay. So waking up a couple of times in the middle of the night would be an issue?
Yeah, our body's essentially shut down to allow us to sleep. We're kind of hibernating a little bit when we go to sleep at night. So we should be able to sleep continuously for several hours before we wake up to begin our days. If we're waking up 2 or 3 times during the night, all of the time, then that's a sign that we may want to have a conversation with our physician to assess for a sleep disorder. If we're tired during the daytime,
would be another kind of thing. So,
well,
April, it's been great to have you here, and like I said, I wanted to kind of have a chance to chat with you for a while, so I really appreciate you taking the time to be on the Mental Health First Aid Show. Thank you for joining us again, and until we are back for another show, be well.